Assalamu alaikum. After so many days, I have come again to discuss another scenario which is worth to discuss. So let's start. An 80-year-old man is having severe low backache leading to difficulty in daily activity. Now, before proceeding further, I want to discuss regarding the age of the patient. He is 80-year-old man. If he would be young man between 20s and 30s having low backache, then first idea which comes in mind that is ankylosing spondylitis. But here an 80-year-old man is having severe low backache. Always remember when you find old men with low backache, what could be the differentials? Now look at the leading causes of backache in old age group. One can be simple disc prolapse. Second important cause can be metastasis from carcinoma prostate. Most of the time, carcinoma prostate metastasize to lumbosacral spine. If these two are not present, then you must think in terms of lytic lesions of multiple myeloma. Now let's proceed further. Patient is taking daily painkillers but no relief is noted. He is also having swelling around eyes in morning which resolves as the day progresses and comes back next morning. So the patient is experiencing periorbital edema. Now let's know when periorbital edema is supposed to occur. Periorbital edema is the one which you read in heart failure. It can also be seen in liver failure or cirrhosis of liver, and it can also be found in kidney involved like nephrotic syndrome or in chronic kidney disease. So that is again an important clue given in the scenario. Now look at the MRI findings. Spine shows lytic lesions in L4 and L5. So either these lytic lesions are due to cancer or multiple myeloma. Let's read further. On blood worker, HB is 10 gram percent. That means it is anemic, normocytic, normochromic anemia with ESR of 100 millimeter fall. It is again very significant. Gross elevation of ESR. In fact, do you know where we find ESR of 100%? We find in multiple myeloma. Serum creatinine is 3 milligram percent means it is elevated. Blood urea is also elevated, so kidney is also damaged in this patient. Urine examination by dipstick is normal. Now, what is the next best step for the management? So first we have to make the diagnosis that why this person has low backache, why is this person having kidney damage, why he is having anemia. We should connect all these clues together. The clinical manifestations found from the crab mnemonic. Do you remember the crab? That is a famous mnemonic of multiple myeloma. From that crab mnemonic, at least three symptoms, three clinical features we are noticing here. So let's look at the crab. C stands for calcium, which is elevated, or you can say hypercalcemia. R stands for renal failure. In this scenario, creatinine is increased sufficient for kidneys to go into failure, and blood urea nitrogen is also elevated. Patient is experiencing periorbital edema, all indicating towards renal failure. Then A stands for anemia and B stands for bony lytic lesions. Here at least 3 points are found: renal failure, anemia and bony lytic lesions. Just hypercalcemia is spared. Now diagnosis is almost made, and that is multiple myeloma. And moreover, the ESR of 100, if you find this clue in your question, then this is gonna be the most probable question of hematological ground, and here it is multiple myeloma. Now we should work up for management in this patient. You should all must be knowing that in multiple myeloma there is overproduction of paraproteins. by plasma cells, that is Benz-Jones proteins. So we should check for these paraproteins. Option A, which says start hemodialysis. In general, there are some indications to go for hemodialysis like pericarditis, severe hyperkalemia, metabolic acidosis, and uremic encephalopathy. But none of these indications are given in the scenario. So I am ruling out option A. B says check for paraproteins. So, what are these paraproteins? These are actually positively charged proteins. In multiple myeloma, light chains are overproduced and accumulated. So, these are positively charged or paraproteins which come from the light chains. So, option B, check urine for paraproteins. That looks like an answer. Let's look at option C. Schedule a kidney biopsy. So nowadays we don't offer initially a biopsy, that is an invasive procedure. And for multiple myeloma confirmation, we don't go for kidney biopsy as multiple myeloma is bone marrow disease. So if in this scenario, the option C, if it was scheduling a bone marrow biopsy, then one could be confused and must have considered this as an answer. But I am ruling out C option because multiple myeloma is a disease of bone marrow and does not require kidney biopsy for diagnosis. Multiple myeloma involves kidney, that is okay, but primary fault is in bone marrow, not kidney. Now look at option D. Start prednisolone for 8 weeks. This is itself a wrong option as we don't give prednisolone in multiple myeloma treatment. The correct answer is B. Please note the dipstick is normal. Why it is normal? Because dipstick only catches negatively charged proteins, that is albumin. It does not detect positively charged or paraproteins which are found in multiple myeloma as Benz-Jones proteins. I hope my this session on multiple myeloma may help you in understanding and solving the questions for the exams. Thank you, and please do subscribe and like my channel. Allah Hafiz.